The first time I came through this part of the city, what I thought was that you never imagined it could exist here. You think it's a third world thing. Actually, you run more risk if you give birth to a baby here in this area of Houston than if you were to give birth to a baby in Guatemala. It's a very challenging situation for the underserved here in Houston.
Here and all across America, federally funded health centers like this are a vital mainstay to primary care for millions of people.
Have a seat.
They can come here and get any service that they need to help keep them healthy, keep them on their medications, and keep them productive in their communities. If you can afford to pay, you pay your full fee. If you can't afford to pay, we waive your fees. No one's turned away for lack of the ability to pay.
Health centers provide a vital service to their communities, and as these health centers are experiencing double-digit patient volume increase, is creating a need to do more with their resources.
How they're going to keep their doors open, how are they going to be able to provide this service, how can they extend their hours to have more capacity for people who meet this need.
But what if health centers approach these questions the way a business does?
The Developing Health Program has a simple goal: to increase access to primary care for people in underserved populations.
The Developing Health Initiative kicked off at 4 health centers in New York in 2009 and has since added 1 city per month, reaching dozens of health centers and hundreds of thousands of people.
The GE Foundation came through in a big way.
It was a monetary shot in the arm.
GE is making a grant to the community health centers in Salt Lake.
The $500,000 is part of GE's Developing Health Program. That's a 3-year, $50 million GE program.
The Developing Health Program builds on the success of GE's existing Developing Health Globally program launched in Africa in 2004.
It's more than just money. With every dollar, with every grant, comes a brain, comes intelligence, comes a heart. And that comes in the form of our GE leaders and our GE employees who help to take on tough issues around efficiency and effectiveness.
They're really anxious to get help from us related to process improvement, related to logistics, related to finance, related to IT.
And this is also what we say in GE. You have to begin with an end in mind.
There's a good match in the types of things they might need and the types of things that a company like GE is able to provide.
One person, let's say,
it's really demonstrating leadership. If you know how to do financial planning, if you know how to do public speaking, if you know how to run a meeting, that skill can be used whether it's inside the walls of the company or in a primary health center.
It's probably one of the most exciting things that's happened to us probably ever, and it's been just invaluable for us.
The processes and procedures that we've put in place are not just here for today, they're here for the next 5 years.
It's paramount for them to really focus on things that directly tied to patients and patient care.
And that's what this program is about. How can we help them increase their capacity such they can reach more people, serve more people?
The relationship with the clinics has been evolving, and I know
GE Affinity Networks and employee volunteers often have a unique connection to people they serve.
My parents are Cuban, and they immigrated from Cuba to the United States, and so I think I have a lot in common with El Centro's clients and that community that they serve. And so it's great to be able to make an impact with that community.
It's not the Hispanic Forum, it's not the African Forum or the Asia Pacific Forum standing by itself. It's all of us.
Can you verify your name for something?
We're helping people who very easily could be a part of our workforce.
Every GE employee has an opportunity to participate in this. It makes you feel good. It makes a difference in our communities.
The network, because that's exactly what we're trying to do. This is Patricia Gonzalez, one of my new friends from GE, one of the most talented, driven, wonderful women I've ever met in my life. I can't begin to express what it's like to see an organization willing to open its doors and share its bounty with somebody else. You're like an incredible light that comes in and opens up a space that has been in darkness for a long time.